So when is a patient ready for joint replacement surgery? With hip replacement surgery, the other joint that I routinely treat, patients can do very well. I tell patients about 90 to 95% of patients do well following a hip replacement surgery. And hip replacement surgery actually is the most reproducible surgery in all of medicine. Patients who suffer from hip pathology, such as arthritis, typically have pain in the groin. Pain in the buttock can be related to hip arthritis, but the sciatic nerve can sometimes mimic hip pain. So it's important for us and the patient to help differentiate the cause of pain. Once we establish that hip pain is coming from the arthritis, the associated symptoms are morning stiffness, achiness, pain with weather changes, difficulty bending over and putting on shoes and socks, just difficulty enjoying your usual daily activities are signs and symptoms of arthritis. The first level treatment for hip arthritis is truly activity modifications and over-the-counter anti-inflammatory medications. If it hurts, don't do it, or try something else, such as people who used to run a lot and that hurts, try swimming. That typically provides a low impact exercise for the joint. Once we have gotten to the point where first line treatment no longer helps, the next line of treatment becomes some type of surgical intervention, specifically hip replacement surgery. And what a hip replacement is replacing the bony cup, also known as the acetabulum, with the femoral head, which is the ball. And we replace that with metal and plastic. You can see here, this patient has had a hip replacement of the left hip. They had the cup, the acetabulum, replaced with a metal liner. Within that metal liner, you can't see this, but it's a plastic layer that helps provide motion of the joint. The femoral head, which is right here, this is made out of a ceramic or what's called cobalt chrome. The ceramic and the plastic allow for a smooth gliding surface that provides a painless range of motion. The stem can be made of different types of metals, but realistically the stem is sitting there to help reestablish what's called leg lengths and offset to provide for a stable hip replacement. Recovery time from a total hip replacement is similar to that of a total knee. I usually tell patients give yourself about 9 to 12 months before you realize the true benefit of a joint replacement. A hip replacement specifically can be done through an anterior or a posterior approach. The most important thing for a patient to do following surgery is to follow what's called posterior hip precautions, especially if we do a posterior approach. And that prevents the patient from dislocating. The goal of a total hip replacement is to provide a stable, painless, functional hip that won't dislocate on a patient. And the first 6 to 12 weeks are crucial for those soft tissues to heal to prevent the joint from dislocating. So following those hip precautions are vital during the recovery process. The goal is also to match up the patient's leg lengths. Oftentimes when the hip starts to wear out over time because of the arthritis, the arthritic hip shortens. The leg becomes smaller. Our goal is to lengthen the leg to a more symmetric leg length, which also in turn provides a more stable hip joint that prevents dislocation. But typically the most painful part of the surgery is just within the couple days following surgery, maybe 10 to 14 days, and we provide patients with appropriate pain medications to help get them through that rough part of the recovery. From the 2 to 6 week mark, 2-week post-op to 6-week post-op, that's really where rehab comes in, and the patient will work on walking, stair steps, kind of doing more or less activities of daily living to help get them back to a normal functional level.